The health of 275,000 people hangs in the balance after the Missouri GOP moved to block the will of the voters. Tomorrow, the state Supreme Court will hear arguments over whether Republicans there can block Medicaid expansion, even though voters approved it in a referendum with a 53% majority. GOP lawmakers admitting they are defying the will of the people. Representative Justin Hill saying, quote, even though my constituents voted for this lie, I am going to protect them from this lie. A bizarre way to describe a plan to give nearly 300,000 people access to health care. This is a broader problem. GOP legislators in states like Florida and Mississippi have also tried to undo the results of ballot initiatives or keep initiatives from getting on the ballot at all. So far this year, Republicans have introduced 144 bills to restrict the ballot initiative process in 32 states. Joining me now is St. Louis Mayor Tashara Jones and Meg Murray, President and CEO of the Association for Community Affiliated Plans, an organization representing not-for-profit safety net health plans. Thank you so much, both of you, for joining this evening. Ms. Murray, I'll start with you. What is at stake here? I mean, Medicaid expansion, we've got 13 different states that have blocked Medicaid expansion after the voters have asked for it, even in red states. What kinds of things are being held up right now? What is at stake because Medicaid expansion has not yet come to the state of Missouri?
Well, as you said, there are actually 12 states that have not done the Medicaid expansion. And it's so vitally important that does happen. We know that Medicaid pays for 4 out of 10 births in this country. It's paying for almost a quarter of all the treatment for substance abuse and behavioral health, as well as a high percentage of nursing home care. So, and it's not only so we know that people need Medicaid for those services, but having Medicaid actually lets people have better access to employment. That's one of the things that I think is surprising for a lot of people. But most people on Medicaid are working, 6 out of 10. And there was a study in Michigan that did do the Medicaid expansion that as a result, they found that more people were working because of the Medicaid expansion.
I want people to really, I was hit by those numbers, but 40% of American births are covered by Medicaid. That is an amazing number, an amazing indicator of how important this program is. Mayor Jones, congratulations again on being elected mayor of St. Louis, the first African-American woman to be elected mayor of St. Louis. I want to ask you, you're seeing this at the ground level in a city that has the same kinds of problems that urban areas across America have. How has the lack of Medicaid expansion affected things on the ground in St. Louis? What have you seen?
Well, thank you again for having me, Jason. It's good to see you. You know, the things that we're seeing are the numbers that your guest just talked about. If it's 40% of births, then that also equates to the amount of poverty that's in the city of St. Louis. We have about 40% of children and families living in poverty. And, the voters voted for this overwhelmingly. It was a majority, it's 53%. And we send people to Jefferson City to enact the will of the people. It's actually a motto that's written on our state capitol. And for them to know that they are abdicating the will of the people by telling the Supreme Court that they want them to uphold them not funding Medicaid it's a disgrace.
Ms. Murray, when you go to these states that the public has said, hey, we want this. And again, 53% is pretty good for a ballot initiative. Clearly, this is what the people in the show me state really want. When you go to these states and you talk to these legislators, what is their justification? It's one thing to say, hey, I'm trying to save people from a lie. But when you hit them with the numbers, when you say, hey, look, this is a national issue, this is affecting people on the ground, what kinds of answers are you getting? Or they just hang up the phone when they know you're coming?
Well, I think a lot of times there is a concern that it's going to cost the state a lot of money, but that's actually really not true. And people are surprised to learn that for the Medicaid expansion population, the federal government actually pays 90 cents of every dollar. So the states are only paying 10 cents on every dollar. And in many cases, they actually are going to be saving money because a lot of the people that will be newly on Medicaid were already getting state services. So the state was paying 100 cents. Now they only have to pay 10. But most recently, the Congress made it even more beneficial for states because as part of the American Rescue Plan, the Congress wanted to incentivize the remaining 12 states to take up the Medicaid expansion. And so they said, not only will we pay 90 cents of every dollar for the Medicaid expansion, so new people, 230,000 people in Missouri potentially, but we will actually give you more money for your old Medicaid program. In Missouri,
Wow.
This is huge numbers. In the next 2 years, the Congress could give Missouri over $1 billion through this incentive program. Now, the state will have to pay about $300 million for the Medicaid expansion. Again, that's only 10%. But they will actually make money on the Medicaid expansion, at least $700 million. So a lot of times the legislators are concerned about, to get back to your original question, about how much it's going to cost. Of course, they're only paying 10%. But for the next 2 years, they're actually going to make money. In Oklahoma, a neighboring state, 100,000 people just enrolled in Medicaid because of a ballot initiative. The state's going to make money on that population.
And Mayor Jones, to take this again to the ground level, this is what you can probably see. When people have access to health care, they can then go look for jobs. When people have access to health care, they can keep the jobs that they have. So what are you doing as mayor of one of the most important cities in the entire state? Have you gone to the state capitol and lobbied on behalf of this? What is your city council doing? What are you saying to your local members of Congress to see if you can get some sort of influence to get the Republicans who are controlling the state house to change their mind about this issue?
Well, business leaders and political leaders and other civic leaders have all joined briefs or also talked to our legislators and talked to our governor about how important this is. And even our governor, he initially put it in the budget and the Republican legislature then took it out. So he respected the will of the people, saying that if the people voted for this, I'm going to put it in the budget, and then Republicans took it out. I think what's also notable here is that Missouri is #1 in the nation for the spread of the Delta variant. And our hospitals in southwestern Missouri are full. They're back to pre-COVID levels. And that Delta variant is spreading across the state of Missouri. And it doesn't make sense to take away health care at a time or in the middle of a pandemic, because we're going to get back to pre-pandemic levels if we don't stop the spread of the Delta variant. Because also a lot of people in Southwest Missouri are not immunized.
Exactly.
And have not taken the vaccine. And even here in St. Louis, we are desperately trying to get people to take the vaccine because 80% of new cases in the city of St. Louis are African-American, yet we're only 20% of those vaccinated.
Mayor Jones, Meg Murray, thank you so much for your time. Thank you so much for your efforts to actually go out there and save lives in the state of Missouri.